Yvonne.
Hi, Michelle. How are you?
We've been getting a lot of questions from members about all things insurance. For starters, what is prior authorization?
Prior authorization is often called pre-approval. It's called pre-authorization. It's called pre-certification. It's called coverage determination. Whatever you call it, it really is a process checkpoint for insurers to make sure a variety of things happen. Is the service that you're requesting effective? Is it safe? Is it cost efficient? It's not an opportunity to say no. It's just making sure that what the provider is asking for is the best request for the member.
This is a way for insurance companies to make sure that medications are affordable for patients because medications don't work if you can't take them. And if they're not affordable, you're not going to take them. Really great points. What do I need to do? If I have a drug that requires prior authorization, what do I need to do to make sure to get that drug approved?
There are some drugs that are covered without any questions being asked. There are some drugs that are covered where you have to answer some additional questions. And so for those drugs where you have to answer additional questions, it's really important to know what those questions are and how to appropriately answer them. Most insurers are now putting that online, or you can have someone in the office call the number on the back of the insurance card because someone will tell you, yes, this is covered, nothing else is needed. Your doctor writes the prescription, you can get it at the pharmacy. Or, yes, this is covered, but your provider has to answer a few additional questions. And sometimes they'll even say, these are the questions they'll have to answer. And so that's the opportunity for you as the member to say, Doc, do you have all the answers to these questions? And we know that it's really easy once you have those answers to be able to get that approved.
Can you say a little bit more about the impact of cost on prior authorization decisions?
We have new drugs come to market and we're having a conversation with a patient or a member about this is what we're going to prescribe and why. And what comes up very commonly is what is the cost to me? If drug A and drug B are the same effectiveness in terms of treating my cancer, what's going to be the cost difference for me? Because what we often don't talk about is financial toxicity. We talk about the dangers that come with medications or the dangers that come with procedures, but we don't talk about the financial hardship that our members and patients have to undergo with therapies that we prescribe. So what is that cost to them? And when you can tell them that there's a cost differential without any change in how long you're going to live, they want that cheaper drug, despite what the physician thinks.
That financial toxicity, that financial barrier is something that's so important to overcome.
Absolutely.